Let's talk about communicable diseases. First one, chickenpox, its symptoms, treatments, prevention, and vaccination. It is primarily affect children but can also in adult, especially if they haven't been vaccinated or previously infected. Chickenpox is highly contagious viral infection caused by varicella-zoster virus, characterized by an itchy skin rash, red spots, then developing into fluid-filled blisters which eventually crust over and heal. Next one, lifespan of chickenpox spot over 15 days. Day 1, appearance of red spot. Day 2 to 3, formation of blister. Day 4 to 6, blister break open. Day 7 to 10, healing and scabbing. Scab remain on the skin for several days. Symptoms: rash. The hallmark of a chickenpox is rash. Rash usually start on face, chest, and back before spreading to the rest of the body. It appears in different stages: spot, blisters, and scabs. Symptoms of chickenpox: headache, fever, cough, rash, gastric discomfort. Chickenpox is an airborne infection. Second one, fever. A mild to moderate fever typically accompanied the rash. Third one is itching. The rash often intensely itchy, which can lead to scratching and potential skin infection. Next one, fatigue. General feeling of being unwell and tired. Next one, headache and loss of appetites. Common flu-like symptoms may occur. How it spread? Chickenpox is an airborne droplet. When an infected person cough or sneeze, it spread to another person. Second one is direct contact. Direct contact with the fluid from the blisters. The virus is contagious 1 to 2 days before the rash appears and until the all blisters have scabbed. Treatments: fever. Fever is treated with antipyretic medication like paracetamol and ibuprofen. Second one is itching. Itching is treated with antihistamines like cetirizine, and also calamine lotion is used for the itching. Next one, treatments of virus. Virus is treated with acyclovir 800 mg tablets 5 times a day for 7 days. Other choice, famciclovir 500 mg 3 times for 7 days. Other choice, valacyclovir 1000 mg 3 times for 7 days. Prevention and prophylaxis. Pre-exposure vaccine. It is called active immunization. 0.5 mg varicella virus vaccine, 2 doses, 4 to 8 weeks apart. Post-exposure. It's called passive immunization. Varicella-zoster immunoglobulin used for the post-exposure. Give within 3 days of exposure if risk factors are more, like immunocompromised patients like HIV, organ transplanted patients, and pregnant women. Premature infants, neonates whose mother had chickenpox onset within 5 days before or 2 days after delivery. Antiviral prophylaxis. Acyclovir 800 mg 5 times for 7 days daily for the person who have 4 days direct contact with the patient. Prevention and prophylaxis. The patient should be kept in a isolation. Clothing and utensils used by the patient should be sterilized. Fallen scabs should be collected and burned. One attack of chickenpox gives lifelong immunity to the person recovered from this disease. Complications. Chickenpox is usually mild in healthy children, but it can lead to complications such as bacterial infection of the skin, pneumonia, encephalitis, shingles. Shingles appears later, as the varicella-zoster virus can remain dominant in the body and reactivate. This form these red-like patterns in the body. If you or someone you know has chickenpox, it is best to stay home and avoid contact with others until all blisters have crusted over to help to prevent spreading the virus. Vaccine for children. The varicella vaccine is advised for all infants between the age of 12 and 15 months. Between the age of 4 to 6, second dose is advised. Chickenpox vaccination for children and adult. First dose, age below 13, 12 to 15 months of age. Second dose, 4 to 6 years of the age. In adult greater than 13 years, any age after 13 years, first dose we can take. Second dose after 28 days of first dose. The second dosage may be delivered sooner than age 4. For instance, during a varicella outbreak, but it should be given at least 3 months apart. The vaccination can be administered either by single chickenpox vaccine or in a mixture that include measles, mumps, rubella and varicella vaccine (MMRV). Thank you for watching.